So I'd like to introduce Dr. Mike McKenzie. All right, he's a part of the Behavioral Health and Nutrition Department, also the director of the Mind, Body, and Behavior Lab, which also sounds interesting. I can't wait to hear about that. He has a PhD in health and exercise science. He's done a ton in the field. Mike is a fantastic person, done a number of research and actual applied programs and seminars on these elements. So it's my pleasure to introduce Mike. Sorry, to distract.
So I know what to do with my hands because I've got two things in my hands. So of course, just a huge thank you to Barrett for inviting me to come and talk today, and a huge thanks to Dean Matt for allowing me to be part of this this program and this opportunity. And thank you for that very warm introduction, Barrett. I always feel like a little bit of a narcissist when there's me and then a picture of me on a sheet. So I'll get over that quickly. One of the things that I wanted to share is before I entered academia, I spent about 10 years of my career working. I was the mental health component, usually of large teams in the treatment of cancer, and a very brief but bright and shining moment working in an extremely busy and volatile addictions detox in Surrey, British Columbia, which is, some of you may know, the sort of the heart of the opioid crisis in Canada. You'll notice, originally from Canada, so you'll hear some A's and some boots, and I apologize. And a day treatment program there as well. So I'm saying all this as a sort of a lead into what I heard from the healthcare theater team today. For me was also, I loved your comment, was reality. And it took me very, very quickly back to some of the interactions that I had with my colleagues and how that affected our patient outcomes and our interaction with patients, and sometimes very dramatically. So some of what we'll do today are certainly lessons learned over a decade of practice, then now having had, oh my goodness, about almost another decade to reflect on it. And I hope there's some useful work for us to do here today. Just a little bit more about the Mind-Body Behavior Lab is we're going to go through some different mind-body practices as they relate to human communication today and interpersonal conflict. And a lot of the work we do is how do we take these practices and match them up with people within their context. So, you know, you as a human being within the broader world that you work. So we like to do a lot of very applied and contextual work. And our other thing is as much as we love the research, our main aim is to get this type of work out into the community as quickly as possible. So we see everybody that we work with as a partner for the long term. And we're very, very interested in sort of developing with the community these education programs and services. So I'd like to start from this place of efficacy. And this is an interesting quote. All things being equal, we will work harder and more effectively for people we like. And we like them in direct proportion to how they make us feel. So as a team, I'd like us to just think for a moment, how was our healthcare team making us feel this morning? I felt sheer terror. Our patient reminded me of a former patient that we had for a number of months for benzodiazepine withdrawal. Who is the sweetest person on earth, but extremely challenged in terms of her health, plus trying to get off the medications that had been prescribed to her that were causing her symptoms. Our nurse practitioner, as sort of the frustrated healthcare professional in the mix, really, really, really resonated for me. I've had people like our physician that understands the business side that I don't, and somehow you sort of try and figure out where you are in that mix when you're trying to offer world-class care. And everybody in between. So a lot of the time, our day gets set up very quickly by how others are making us feel. And certainly our day often doesn't start at 8 a.m. when we get to the office. It starts for me this morning at 5:30 when my 18-month-old decided it was time to wake up. And it proceeded through that time. It's my checking my email. So there's all these components of communication that are happening throughout our day that are sort of creating this narrative that we live and breathe in. So I want to take some work from Google that's been sort of occurring over the past decade as an interesting model that's out there now that we're starting to draw on. And I know that Barrett draws from this model as well. And one of the things that they've decided to do is Google is this extremely high stress environment with lots of very quick deadlines, a lot of failure, for lack of a better term, in terms of if a product doesn't go to market, it can be months, sometimes years of work. If you want sort of a humorous look at what Google looks like, you can watch the HBO show Silicon Valley, and you can imagine the chaos that ensues. So really what they started to look at through a gentleman by the name of Ched Mengtan was this whole concept of mindfulness, which we'll talk about in a second. Google at one point in time, they would give you back between 10 and 20% of your time to do whatever you want. And that sounds like a pretty good gig, but really it was like, we'll give you that time, but you better be able to monetize it and get it out the door. So Meng decided that he wanted to do this mindfulness project. And they said, you're nuts. Why would we give you time for that? But he's a convincing guy. So 7 years later, it's still the most popular continuing education program at Google. Even within Google, with all the trainers that they've hired, it's still a 6-month wait list to get in. And it's one of the most quickly sort of monetized behavioral programs that Google has ever done. So it's offered across the healthcare industry, Fortune 500 companies. It's a very, and a number of business schools are actually picking it up now. I just went and did a little training with them in Toronto in July. But what we're finding with this mindfulness research over the past sort of 25 years is we see that it reduces stress, enhances recovery. So if you do take a hit, you get up a little quicker, which is sort of this component of resilience, heightens well-being and job performance. And the interesting thing that we're finding in terms of some of the research that we're doing right here on campus in UD is that we're finding these same things when we're working with our faculty, when we're working with our staff, and now based on a new opportunity when we're working with our students. So this is happening at the University of Delaware right now. So one of the things that Google was interested at overall within their work setting is these sort of 5 points. And we're going to sort of work our way down, and then the next slide we're going to work our way back up again. So the first thing is that there's this sort of notion of psychological safety, that you can come into work and kind of be you and get your job done, and everybody works together and they're okay with that. And we're going to talk about intractable conflict in a minute, because for many of us, we walk in the door and there's something there that we would love for it to be within our control, and brothers and sisters, it ain't happening. So we'll talk about that today. This notion of dependability, that if Dr. So-and-so is going to show up, Dr. So-and-so shows up. And if Dr. So-and-so doesn't show up, we have a mechanism so that nobody loses any sleep. We have structure and clarity within our roles, which we'll talk about again in a second. Meaning is very important. And this is a tough question, but I always put it to the people that I work with. What's the thing that's getting you out of bed in the morning right now? And if it's just a check most days, it's not that you're not doing your job right, but there's something within this organization that something is not adding up that we as a collective need to work on. And that's one of the things that we'll talk about today. And then not only is this meaning, but that you're finding that there's impact in the work that you're doing, that it has value not only for yourself, but for your surrounding community around you. Okay. So I want to talk, this is the most uncomfortable slide we will do in my little neck of the woods today. And then we'll do a little practice together, and then we'll have some time for some conversation. So this is some interesting research out of the management world in terms of dysfunctions in a team. And this resonates within sort of a business setting, but what we're finding more and more as healthcare becomes more business, that it actually really, really resonates within a healthcare setting as well. And the first thing that we see, surprisingly, that's sort of at our base here is this notion that there's an absence of trust. That it's very difficult for many of us to go into our work environments and sort of, again, be ourselves and know that we can depend on the others around us. So when you know that, the next thing that often comes up, whether it's internal or interpersonal, is this thing that I think why Barrett signed me up today, is this notion of conflict. You have to swim in those waters. And some days, those are some pretty rough waters. So what do? For most of us, we tend to just sort of pull back a little bit. Maybe not a lot, but we just kind of pull back a little bit. And it's a fairly protective mechanism. And most of us have other things going on in our life that we're doing very well at. I pull back here so I can give more over here where there's a higher yield. And that's healthy. That's a good thing. Sometimes you need to pull back so you can, like I said, my 18-month-old is insane. I'm 44 years old. I don't even know what I'm doing most of the time. So sometimes I've got to pull back so I can deal with the insanity that is Ruby. But the challenge when we start to pull back is then sometimes what we see within teams, and it doesn't reside with any one person, though sometimes it can, between you and me, is we see this avoidance of accountability, right? So the buck stops over here, maybe right here, oh, maybe it could stop over here. Right? And this is where our team lines get really, really blurry. And from there, we see this other thing, which most people spend most of their time on, which is this results focus. And we're going to talk in a minute about how incredibly harmful that can be when we're just sort of down to results and we're missing all these other levels that are going on within this interpersonal teamwork environment. Okay. So that's the meta perspective. Here's another opportunity for us to reflect on what we sort of saw today with healthcare theater. This is our basic human communication paradigm. And it's messed up. This is on a good day. This is on your best day ever. Everything's going great. Boy, woke up, baby didn't get up at 5:30. It's like 7, which is like when you were a teenager, like sleeping until noon. It's amazing. But here's these challenges that we have. The words that I have in my head very rarely are the words that come out of my mouth. For whatever reason. Sometimes it's because I'm kind of saying something in the moment. Sometimes it's because I haven't had time to reflect. Sometimes it's, who knows? But from here to here is a fairly significant gap for most of us. Throw a little stress on top of that, it gets a little bigger. Okay. Our next component is really this notion of what do I hear? Or what does another individual hear? So the words come out and they sail through the air over to, let's say, well, they're going to go to Barrett. To Barrett. Barrett has been singing a Justin Bieber song in his head for the last, right? Obviously. Who wouldn't? It's a Canadian icon. Yeah, it's amazing. So Justin's in the middle of this, the lyrics to, or Barrett's in the middle of the lyrics to Love Yourself. And then I interject with some words, and all of a sudden he's got to go, oh, Mike is saying something, and he's got to create some sort of semblance of meaning based on whatever, maybe it was Bieber, I don't know, based on whatever was going on in his head. So here's this other, there's already been this sort of level of abstraction, and now simply another level of abstraction of meaning. So our next abstraction then is that Barrett has got to sort of run this through the Barrett filter in terms of what he understands. And we all have these filters that we understand. And I can't think of a more incredible example than what we were able to do at the healthcare theater today, how you saw these different filters. Our poor patient, never knowing any of this other narrative, is sitting there just going, I'm embarrassed that I forgot my pills. I'm embarrassed that I need all this help from my family. The way that I'm going to work with that is I'm going to focus on my granddaughter. And when things aren't going to go the way, because they never go the way, you know, like, I hate to say it, there's this morbid curiosity. It stopped at the doctor walking into the room, and it wasn't the doctor was supposed to be, and then there was a pause scene. And I'm like, let's keep this train wreck a-rolling. I kind of wanted to see what was going to happen next, right? Because you know it's not going to be good. All right. So then our next component then is Barrett's got to communicate back to me to keep this ball rolling. There's a lot of ambiguity going on here in just our basic communication with people. We throw conflict on top of that, and the whole world can kind of fall apart in a day or in a moment. So let's talk about some tools that we can use with that. So one of the things that we are starting to work with, and this is research that's been kind of ongoing now for about 25 years. A lot of these practices sort of date back a couple of millennia. But within this sort of contemporary parlance is this whole notion of mindfulness. And so this is my favorite mindfulness picture. So when you're out for a walk, if you have a dog, are you seeing the trees? So our dog here sees the trees, maybe thinking about which one to pee on, but probably not much more than that. Or which one to sniff. We can keep it PG. And then there's this person here that the trees aren't sort of in the framework. And I had one of our participants in one of these groups a few weeks ago point out to me, they're like, oh, they're a university professor. I'm like, well, what do you mean? They're like, did you see the lectern? And I'm like, oh. So much for mindfulness. But really, this clarity of thought has a lot of value. So this whole concept of mindfulness now is within our sort of, our very sort of recent past has become something that we hear a lot about. It's on the cover of Time magazine. You can actually buy Mindful magazine at Barnes & Noble now. It's become kind of a buzzword. And so let's work with a couple of different definitions. And the first thing is that we're starting to train our attention in a very deliberate way. And it's just sort of paying attention on purpose in the present moment without a lot of judgment as things kind of unfold. The next definition that we can use is this regulation of attention to focus on our immediate experience and having this attitude of curiosity, like, well, I wonder what's going to happen next. Openness, I'm kind of open to whatever's going to happen next. And total acceptance, I accept what is happening right now. Whether the experiences are good or bad. And we're going to play with this in just a second. What I want to say is that these practices it's not this one mindful thing. It's dozens of different ways to sort of train our brains. And that's really the way within sort of psychology right now and behavioral sciences, we're looking this as ways to train the brain. The same way that you would hop on a treadmill or ride on a I was going to say unicycle, and that's not right for some of us, or ride a bike. We can train our brain the same way we can train a muscle. So here's a typical skill set that I work with that's both a practice in it of itself, and it's also a litmus test to see how good I am at doing different things. So let's play with this together for a minute. Like we're like kids, and it's our first time getting on the bike, and it's going to be a little wobbly, and we're probably wishing the training wheels were still on there, and we're kind of skidding around corners, but we're having fun, okay? No scraped knees. Did anyone sign the waiver? Okay, good, all right. So the first question I would put to you is, how good are you at any given moment at gathering your attention, of taking your attention from one thing and just taking all that attention and just kind of bringing it over to this thing over here. Okay. So my invitation for the moment is just take a moment to gather your attention right now. What does it go to? Does it go to kind of my voice? Does it go to the paper in front of you? Does it go to all the funky sounds that are going on around you? Where does your attention kind of go? And we can train this. This is a trainable thing, and it's going to go all sorts of crazy places, and we can just sort of bring it back to whatever it is we want to direct it to. So focus of attention is a very powerful tool that we can train. And it becomes really important within interpersonal communication and conflict in a second. The next component is our intention to do anything. So how many of you sort of have some vague list, either on your Google Calendar, or maybe you have a journal, or maybe you have it in your phone, and you kind of just do things all day until the list kind of either goes away, or there's things that you can put off to the next day? Okay, very common, right? So the question sometimes is that we ask people to come back to is kind of what's the intention in any moment? So the example that I like to give, because it happens for me all the time, how many of you at your workplace now have more than one screen, like 2 screens? See, that is cuckoo bananas. Can you imagine ever in your life you would have thought 2 screens? No, one's not good enough. I need 2. So my question, you guys don't, and this one, nobody has to stick their hand up because we're building a culture of trust, but I do like blinking. How many of you, in old screen number 2, maybe you have something else up on that screen? Maybe it's like, like Amazon, or maybe it's like it's something else that you like to kind of look at. It's kind of it's got your work on there, but it's also kind of your break screen. Anybody blinking? I saw an eye roll. I saw some head shaking. I saw that I'm not even going to blink. It's a trap. All right. So what we find sometimes in terms of recalling this intention is we can be working away, and our body says take a break, And the break is screen number 2 versus get up and go for a walk or go do the other thing that you need to do or go and have that conversation that you need to have. And we end up seeing a lot of, particularly in academia and particularly in this work where we all have multiple clients, this sort of fatigue burnout where we're kind of wired all the time, but we're kind of tired all the time. So this is a concept that we kind of call tense tiredness, and it's a very real thing. So the next component we want to work at is how good are you at kind of attuning yourself to your environment? And that can be your external environment in terms of the things that are going on around you in any given day. And that can also be this internal state that we just started to talk about. When you walk into an environment, do you kind of know how much energy you have in reserve to deal with that? When you walk into a new situation, do you know how much sort of cognitive capability that you have in any sort of given moment? And the reality is sometimes I can do this level of job with the reserve that I bring in, and sometimes I can do this little level of job. Being able to sort of know that about yourself creates tremendous value, particularly we add that spice called stress. The next component we have is this sort of the consider our actions. So some of us are very reactive depending on the situation, and we just kind of gonna sort of put out that fire. Some of us are master deliberators, and we're like, it's been months, and we're still like, but I'm only down to 22 options, and I could probably get down to 19 by the end of the day, right? So this ability to be able to consider your options and implement them, this is a really powerful skill set to be able to develop, which leads to this enaction of our plan. Can we go in and kind of enact the plan with somebody? So I'd like you to sort of just take a moment to just do this together. Can you, from wherever we've been talking about, can you just kind of bring your attention here? Can you take a second to sort of reflect on why you showed up today? Like, what was the intention of being here? Can we take a moment to sort of attune ourselves to our environment? Like, how much really kind of energy and cognitive reserve do you have to kind of be here today? Can you kind of consider your actions? So what is it that you're going to do to get what you need to get out of today? And then what's the game plan? How are you going to get it? So for most of us, we can do these types of scenarios and do this mindfulness stuff where we do a lot of really formal practices, and that has tremendous value. But for me, working with busy healthcare professionals and working with busy everybody, what I find is that they want the tool to solve a problem. So here's a tool to solve a problem. And we're going to talk a little bit more about that in a second. Okay, so first off, take a moment to chat at your table in terms of, what do you make all of this stuff? Let's just take 2 minutes. People are naturally pairing, but that is not does not have to be. Just you can talk as a team. Good, dynamite, awesome, good. We're all just about really just kind of connecting people. All right, so what did we get for, and we'll just kind of go along randomly. What did we get for G? What did we get for gathering our attention? Anybody have any insight towards that? Okay, let's, you know what, we won't go through the letters of the alphabet. Just general thoughts in terms of this acronym. What do you think? I'm going to do every table. Yes?
Well, one thing that we talk about is this for a moment? Sorry. One thing we talked about is the question is this for a moment for a given task, or is this for like daily?
Yeah, let's talk about that.
Okay, and then the second thing we talked about is as you're gathering your attention and your focus, what happens to those other things that kind of interjects itself while you're trying to focus your attention, and then you get the phone call that takes your attention away. So now you're refocused on this when you know that you have this stuff to worry about as well. So
this is good. So let's do the first point first. Like, sort of, when do you kind of implement this? So what I've found over time in terms of how do you sort of roll this out, I do this the most when I'm transitioning from one thing to the next. So this is my go to the bathroom. Not like when I'm like, not to get too over or whatever, but you know what I mean? Like it's not like in there, but on the way. Yeah, there we go. I know. Okay, PG. Let's keep it good. All right. This is my transitioning from one task to the next in terms of computers. This is my, and now that I work in academia, this time of the year, I have a lot of difficult conversations with students, and this is my transition for students. When I used to work with patients, this was my transition with patients. Sometimes we had an oncology team that didn't always gel, let's put it this way, and this was my transition sometimes in terms of talking to oncologists. This is always my sort of the thing that I do before. And when buttons really kind of get pushed, I'm usually picking one of these things to work on. For me, my default tendency is to be a little bit quick with the tongue. So I often have to kind of do the rack component, the recall, attune, and consider your actions before the words pop out of your mouth. So again, it's just sort of something to play with. In terms of this component of, you're trying to do this and the phone starts ringing, this is a brilliant, brilliant point. And it brings us to this notion of multitasking versus sequential processing. And the reality is, most of the research that's out there now in terms of cognitive psychology says that there's no such thing as multitasking. I know. Get ready. It's going to get worse. Don't. Yeah, I know. So, yeah. So we do a really, really good job of sequentially processing things really, really fast to the point where it feels like multitasking until you throw the stone that is stress in there, and all of a sudden we find that we're not doing that. So how many of you have ever found this thing? And as I'm getting a little bit older, I'm finding that I have to write things down a lot more. Yeah? Are we on the same place? Hello? Okay, right. So my working memory doesn't work like it used to sort of hold things in reserve so I can sequentially process. So I need a lot more, for lack of a better term, aids now. I need help. So I use my phone a lot. I hate to say it, but my wife would, if she was here, she'd just shake her head. My wife is kind of my eye brain. So rather than me remember it, I tell her because she seems to be better at it, which is so unfair. I see so many people shaking their head at me right now. I know, but it's a habit kind of thing. So this sequential processing piece can be really, really interesting. So in terms of when the phone rings, is this the opportunity to go, phone rings, I'm going to switch gears? Or is this the opportunity to go, phone rings, I'm doing what I'm doing? And that's what the answering machine is for. And sometimes it absolutely is. Pick up the phone and I'll get back to it. I can reattune to that environment. But sometimes that phone's going to ring. It actually rang yesterday. And then I called them back and everything was okay. All right. Okay, so we talked about this. So again, there's this notion of we can do this, kind of as in a preparatory way, and then there's this notion where we can do it in difficult situations. What I tend to tell people to sort of start to think about is how can you pre-plan those difficult situations? So for our poor nurse practitioner, sounds like this isn't her first time sort of bumping up against this hierarchy within her practice. So how can we start to kind of plan for that? Because it's going to happen again. The more that we plan for this, a lot of the time what people find is it takes the pressure off being right or doing the right thing in any given moment. Because we know that it's iterative. And we know that the situation that we walk into might be not be the situation we walked out of. So our horrible example today was we're going to have to reevaluate your role in this practice. Well, all of a sudden, that's a very, very different conversation than I need sort of more support in terms of the work that I'm doing, in terms of my physicians. Rather than trying to solve that whole mess in one conversation, better to walk away and do some planning. Okay. So this is another thing I'd like you to think about. We're going to take that skill set that we just worked on and we're going to apply it very simply to interpersonal communication. So we can take this sort of attentional qualities that we're working at and we can really sort of start to work it into how we're working with other people. So I'm going to introduce a few goofy words. And we're going to talk about, and these again are just very simple attentional processes that are going on when we're communicating all the time. So it's sort of level 2 of that first diagram that we looked at. So the first component is this component of listening. So when we're sort of engaged in conversation with somebody, are we really showing up enough to hear what they're saying kind of thing? Can we get the Justin Bieber song out of our head? Or whatever else is going on, are our preconceptions about that individual. So for our nurse practitioner, you just told me that there was a veiled threat that you were going to fire me, and now we're going to need to communicate again. And I'm not sure how much I can hear from you without thinking about losing my home, right? So that's a really important thing. This next component is looping. How do we sort of feed some of this stuff back into a conversation in a way that's meaningful? Maybe not that next conversation with that person, but at some point that needs to happen. And we're going to talk about intractable conflict in a minute. So I know that these situations get far more complicated than what we're going to talk about today. The next one that's really important is this ability to dip into our own experience. So when you're communicating with another person, how much are you needing to sort of dip into your own experience in order to facilitate communication with them? We see this all the time in our sort of patient communication settings where a patient brings up something that's a relatively hot button issue or something that's sort of a typical thing for a client to do. So the classic example that we had today was medication, right? Seems really, really innocuous, except when you realize that this individual has been seeing multiple doctors and now has multiple meds and we don't have a unified electronic health record. So this actually creates huge challenges in terms of what they're taking, how much, do these medications interact, and does this change any other sort of treatment protocol? What most patients don't know, and what we don't implicitly know sometimes, is that we're trying to retrieve all that information and do all that processing while we're engaging in communication with somebody else. A lot of what we see in terms of patient communication is the more that we can explicate on our end what it is that we need to do, the more that the patient is able to come alongside us and sort of co-pilot that ship. So we saw that a ton, particularly in terms of cancer treatment, in terms of why am I receiving chemotherapy? How much am I going to receive? What are the side effects going to be? And what is this going to mean in terms of my health? And basically, what a lot of patients wanted to know is, how can I help? It might not be the words that come out of their mouth, but what can I do? So within the sort of mental health component, we tended to see people sort of, a couple weeks post-treatment or sometimes several months, and they're like, they're gone, and they sort of carried me for a long time, and I'm thankful for it, but now they're gone, and I don't know what to do. So explicating this communication can be really, really valuable. So just take a moment to think about, for each of you, if you could just sort of take a moment, you might want to jot a couple of notes down. Think about a recent situation that really sort of taxed that listening skill set. Think about a recent situation where it was challenging to sort of loop back in and provide some additional information to sort of keep the conversation going. And think about a recent conversation that really, really made you dip into your own experience in order to sort of stay with that communication with somebody else. So listening, looping, dipping. Again, I can't remember anything anymore, so I just jot things down. Okay. Tell you what, just take a minute and chat at the table, and we can sort of clarify around these roles. Basic listening in a challenging situation, basic sort of looping in terms of keeping the conversation going, and dipping, how much do you kind of have to dip into your own experience to kind of keep that going? So I noticed this time the conversations sort of shifted more to each table as a whole. So I'd be curious to hear a little something from each of our sort of table cohorts. What kind of came up? And I have a microphone that I'll also bring over. No pressure, but a little bit of pressure.
Well, we just talked about the challenge of listening when you've got someone whose every conversation is the same thing in a different form. And they really just more, I think, want to vent. And so, you've heard that story, you've heard that song, and you find yourself zoning out and just letting them go on and on. Because sometimes they're not really looking for a solution, they just want to vent.
Absolutely. So what do we do when the narrative that we hear is the same story? Like Twinkle, Twinkle, Little Star was pretty awesome the first time. Can you tell where I am in my developmental parenting thing? 42 times through, loses the luster a little bit. All right, we're gonna talk about that. Oh, we're at Elmo. Guess what somebody's going at for Halloween? Oh. Any thoughts at this table in terms of things that came up? Again. Oh, thank you very much.
So we were just talking about how we may be working on something, and then as leaders, we're all attuned to this open door policy. So our staff can come in at any time, and if not, we're seen as, not being an open door, leader. So we'll be working on something, and then Shannon said, instead of saying, like, can you give me 5 minutes? We stop what we're doing, but we're so worried about the other thing that we're not really giving them our focus. If we just would have asked for 5 minutes, although who knows what that other person would have thought if we asked for that 5 minutes,
So even explicating that part of the communication, huge.
Absolutely. So, yep.
Thank you very much. We're good? Okay. You're the great team. All right. Okay. Anyone over? Just as I stick it like right in your face. I'm sorry. Any thoughts at this table? Yeah. Thank you very much. Good job. Thanks.
Yeah, Rita. Yeah, you were a part of the conversation. So we talked a little. Well, I was calling myself out, saying I'm not sure of what type of listener I am. I think being a communication speech language pathologist specialist. Yeah. Mm-hmm. So listening is. And we were talking about student education, so getting students most of the students that are showing up in healthcare and are interested, the factor that they have is wanting to help people, and which is a wonderful decision in their mind that they are attracted to this. But I think in a very short period of time, I feel a lot of pressure as in my area is, sorry, Barrett, but the soft skills and the professionalism involved with these students. I spent a lot of time having these conversations, is really getting them to understand that helping people help themselves is how they're going to do this for 40 years and do it well. So I think the listening part for me is I have an addiction to solving problems. I know that about myself, and as soon as a student, staff, anybody comes in, I have to get my attention to know and remember that if they solve their own problem, there will probably be better follow through, there will be better outcomes, better health measures for them, and I will have time to work on my own problems, which I do have, and we'll all be in a better place. I have both. Yeah, I have both. But I think that's a new shift in not trying to fix everything for everybody, but we want everybody to fix situations. So I think that's where I think I'm okay with looping and dipping. I think that's just that's back in speech pathology world, that's pragmatics of turn taking. And that's what we do. That's a good conversation. It's not like you talk, and then you're done, and then I talk. That's what some of this listening requires. Not so good at that. I'll work on it, I promise.
I have tremendous confidence. Yeah. Yeah. Any thoughts? No. You've been nominated. Oh.
Just give an example.
Sure. Is that okay? Yeah.
I was just giving an example how yesterday there was a situation in our clinic that
there was a misunderstanding that maybe I understood what somebody was talking about, and I thought I did, and then found out that I was not understanding what she was talking about. So I could have listened better. She could have explained better. So I think we both could have communicated a little better.
Run around for hours.
Yeah.
It went around. It went around.
We were kind of like reflecting on the looping part where it ended up just being this loop of miscommunication, and 2 hours later we finally figured out what the crux of the problem was. You know, it's kind of it ended up being a waste of energy if you're not communicating effectively. Yeah.
And that looping piece can be a really tough part of the narrative, because then it's not only kind of whatever the situation was, it's this whole other experience that sometimes is really effectual, but there's some challenges that can go along with it too that can be very well intentioned. And I may or may not have a slide where we can chat about that a little bit more, because I think it's really important. Did anyone at the table care to? Yeah. Thanks, Bishop.
We were talking about a situation that often comes up in our small practice, where I'll get a message that a patient is complaining about their bill. And right now, I take care of a variety of things, but that's one of them. So when I get the little pink slip, in my mind, I'm anticipating, oh, okay, I look it up on the computer. It seems clear-cut what the story is. So I have this thought in my mind as to no problem. But then when I finally catch up to the person and I listen to what their understanding was, and they didn't understand that for them, no shows, what it meant coming an hour late and we couldn't fit them in. They don't understand that that's a problem. And then they tell me about how they're a caregiver for their elderly parent. I'm going through that right now. And so even though we have a rule, now all of a sudden it becomes, muddy. And so how do we handle that? But so it's I think it helps the patient. Sometimes it's difficult for the practice. There's a conflict. When you dip, it becomes, more of a conflict for us.
It goes back to those sort of competing cultures that sort of I live in this world where this all makes sense, and I'm engaged in this billing process all the time, and this seems commonsensical, versus the person that's living in this world over here where it might have taken them 5 years to get to the doctor in the first place, and they're always very tentative, and I know this. So my personal experience working with particularly with male cancer survivors, and usually for our lung and head and neck, they were always kind of had one foot out the door. Like, I'm not going to quit smoking. Just let me kind of go back and take care of my family till I die. And anything else, I don't want to communicate around, because I'm already, my wife kind of dragged me in here, and I don't know who's going to drag me out of here. And they're just two totally different worlds that kind of start to. And then it's tougher for the health professional, because they're the one that's the expectation is that they're the ones that lives in both worlds. And that's a huge expectation systemically. And I think we as healthcare professionals take a lot of that on as well. And we're going to talk about that in a second on this sort of what we call collateral damage. What happens when your day was done at 5, but you go home to another world from 5:30 till 9 that you exist in, and then you come back into this other world at 8 o'clock or 9 o'clock the next morning. Yeah, sorry.
I just wanted to say that is this idea of kind of dipping and then building empathy. Does that really? I mean, that really care coordination really lends itself to that, because then you can. Hear out the patient. And sometimes that's, I answered domestic violence hotlines for about 10 years. And so you want to fix the situation. You want to immediately get the person to safety and make them, and help them immediately. And that never or rarely happens. So just listening and validating. And then accepting responsibility for what you can. I'm really sorry that happened to you when you went to the court system. Or I'm really sorry that happened, that there was confusion over the bill, or you didn't realize that you were getting those charges. And then and then taking responsibility for what you can do. Like, it sounds like it's really, it's an enormous challenge for you to get into the appointment, and I can only imagine how difficult that must be given da-da-da-da-da. So is there anything our team can do to help you with transportation or whatever, and then move, and then it gets away from, I can't change the fact that you're going to have to pay this bill, maybe, but I can do other things to help and organize that.
Absolutely. So what what are the things that we can do to get alongside the client with how do we goal seek within the constraints that we have? And again, to be able to just sort of explicate that for somebody can be really, really helpful. Like, I can't take the bill away. I can certainly direct you to somebody that might be on their radar. But here's the things that I can do for you. One of the things that our treatment clinic in Canada that we realized we did a horrible job of is once people were leaving, our list of sort of secondary and tertiary service providers was awful. So one of the things that we implemented is that a service provider one of our service providers at least once a month would go out with somebody else in the community for coffee, just so we kind of knew each other. So I know I call Al for this, and Al knows who I am. And then we can there's more of a warm handshake. And it made a huge difference in terms of some of our work.
It's just a general comment about mindfulness.
Yeah,
going
please.
back to these tools. I've been to a fair amount of continuing education trainings where the generational differences, comes up a lot, and just trying to understand that across our profession. And I definitely feel that mindfulness is something I could have benefited from when I was in my 20s, when I entered into the workforce, and nobody cared about, me and my peaceful self and being in the moment and letting things go. And so this newer generation, and obviously whether it's millennials in school and college and training, or just new professionals coming out, because I think when they show up at your door, and they've always been dealing with an open door policy, they don't have their priorities sometimes lined up as to what should be coming to the door and what would not. So I guess my concern is that with this mindfulness, and I feel that my students right now actually embrace this full-heartedly. They've grown up with this. They do a great job of, making sure they treat themselves to nice little things, and they know when they need a break. So I don't want to overswing here in this direction, and I kind of want to get in the middle. I think we all need mindfulness that have been at this, but I think our students sometimes still need to be directly challenged about, it's not all, they have to kind of integrate all this information into still being professional, and they can't call and they need to wait sometimes. And so how do we balance that?
So it's incredibly true, and this is this has been one of the sort of challenges that I've seen as this work has kind of expanded over the last 20 years. So the joke that I often tell people that I work with is when we started doing this stuff in the 90s within cancer care, it was kind of like, you want to do what? There's a room over there. You have all the time in the world to do this. It's called evenings and weekends, and that's what you get. And that was okay. What we've sort of seen with the sort of explosion of these mindful interventions, and particularly sort of this population of yoga, is this sort of self-care is self-indulgence. And this, there's always and this is not to take away from any of these phenomenal programs that are out there, but that, it's just, life's problems are just, a retreat away at Omega or a Kripalu, and then everything will be right in the world. And the reality is when you sort of look at where a lot of these practices come from, one of the first things that they really sort of focused on is just sort of being able to be aware of your own mindset, develop some detachment so you can make better decision making. It was very sort of concrete and objective, and then sort of immediately was really immersive in terms of how you were kind of working within the community. And as it's sort of become more popularized, there's been a sort of a simplification that goes with it that I think sometimes goes to, if I'm not feeling good, then therefore it's bad. And I think that that's really far removed from where a lot of these techniques came from, where there's sort of that first slide that I put up, that first definition, good or bad, a lot of the time really don't come into it because it's just kind of life. and you gotta deal with it. Sometimes it feels good, sometimes it feels bad, but at least you kind of showed up. Yeah, is that helpful? Yeah, but I've certainly can resonate with that other approach is out there, and sometimes it really swings too far the other way. I would agree 100%. Any thoughts over? We're good? Okay. All right. Good job, team. I lost my thing. Did I? Thank you. So much for mindfulness, hey? All right. So when we're working with teams, and this is some work in terms of this notion of a team-led healthcare model. It's a gentleman that sort of, you see his sort of footprint in many places as a gentleman named Thomas Bodenheimer at UCSD. He's a internal medicine specialist that's now very sort of focused on the sort of the healthcare environment, particularly work within teams. So one of the things that they really sort of look at in terms of how we're working within this notion of the team is, once we're sort of cultivating this skill set, we have more opportunities to engage in conversations then around what are one another's roles. And it's amazing, even within a simple team, how oftentimes those roles are poorly understood or unnecessarily blurred, and with either people wearing too many hats, or people not, even if they know what hats they're wearing, nobody else kind of knows what's going on. So this is some interesting places for communication. With that, there's often this notion then of if we're going to operate it as a team, let's operate it as a team versus a collection of individuals. And some of the challenges that we kind of work towards there is really our sort of, what are our roles and what are our initiatives in terms of allocating that workload. And the next component then is, what does this sort of delegation component look like? So we see this all the time with leadership teams all the time, is that we sort of have the good meeting, and then the world falls apart between the good meeting and that sort of the next time that we connect. So rather than sort of delegating responsibility, what's the process we have by which we delegate? That's not just if it doesn't work out. And this is a really challenging situation for our leadership teams, that the door is open and we'll just problem solve it in the moment. Because the challenge we find a lot of the time is that then everybody's just running their own deal. And we see a ton of this, and it happens in academia all the time. It happens within healthcare all the time. That is, we have these sort of unifying conversations, but at the end of the day, we're just back to being a collection of individuals that sometimes comes together. So I want to talk about that a little bit more here. So we already did that. I want to talk about this whole notion of conflict, which again, I think that's why okay, good. All right. And I'm going to, based on some of the conversation that's coming off, I'm going to have to come off script a little bit today. I was joking with Barrett over the weekend. I'm like, Barrett, do I put in the secret weapon slides? And he's like, well, we got to watch the time. And no, so do you feel like I'm throwing you under the bus? I'm not intending. As the words are coming out of my mouth, I'm like, is this making Barrett look bad? And now I'm like dipping into my own conversation. Barrett's been nothing but good to me. Why would you say that, Mike? He's the best guy you know. This is terrible. What is wrong with you? So anyways, so in terms of dealing with sort of high conflict and resistance, we're going to talk about that a little bit. And there's a couple of slides that that I will extemporize on that aren't in the deck. He really is the best guy. All right. So really the notion around conflict is these reoccurring patterns of ineffective communication. And what we know, so this is from the Archives of Psychiatric Nursing, is really when this conflict reaches this place of being intractable, like it's not going to resolve itself by any human means, we see a lot of bad feelings. We see these damaged relationships. We see depression, aggression, anxiety, substance abuse, like any tool you can use to cope. And then we go, okay, that's what's going on with you. Off you go to work. And there's that person or that situation that engenders all these qualities. And I'm going to just, off I go to work. Here I am. And, going to go cry in the bathroom now. And here I go. Okay. Going to drive home maybe a little quicker than I should have. Music's a little louder on the radio than it needs to be. Was shooting for 8 hours of sleep. Looks like 3.5 is going to be what I get, So that our people are embedded within a larger life of which work is a big part, but not the only part. So one of the things that we want to help people with is sort of bringing some attention to these pieces, and not only some attention, but some workable solutions. And there's a diagram here I want to share with you. And this isn't. I wish this was a happier diagram, but I think as one of our team today shared, this is reality. So let's just sort of talk about reality for a second. So the reality is when we first start applying these mindfulness skills within a high conflict situation, this is what happens. As we heighten our awareness of self and others, we go through this thing that we all do all the time because we're all really, really bright people, this rational cycling. I can solve this problem. I'm the problem solver. I'm going to solve it. And I come up with all my strategies and all the conversations that I could have or wished I had, all the narratives, all the times that things have gone wrong before and what I could have learned from that to bring into this situation. And that narrative goes on while I'm working, while I'm grocery shopping, while I'm walking the dog, and the story kind of keeps getting told. And the reality is, a lot of the time, once conflict becomes intractable, there's a failure of our rational reasoning. I used to share with clients, if we were both rational human beings, you and I would have one great conversation, we would shake hands, and I would never see you again other than at Starbucks. And then we would just talk about coffee. But we're probably going to see each other for like 12 weeks. Because the things that we sort of talk about cognitively, when we go back into the world with all of our stresses and all of our history, it's not just this simple sort of cognitive problem. There's all these other complexities that we need to sort of keep in mind. So the next component after that is if we can sort of get people away from, and again, with adequate assessment, if we can get people away from this into this sort of accepting the sort of the reality that they're immersed in right now. Again, it doesn't get any better here for a second. Because the next thing that we often deal with is people have a broader insight as to kind of what's been going on within this sort of conflict and within the workplace. And that is often the notion of there's been some collateral damage here. Like this relationship has been kind of goofed up, and it's kind of goofed up some other relationships over here, whether it's in terms of patient care, whether it's when I get home I'm a little snippy, whether it's I'm not as functional as I have been in the past, whether it's I'm starting to feel burnt out or my personal achievement is going down, that this is kind of the challenge that's happening. So we're using this in terms of a team-based model right now, but I could easily look at sort of cancer pain, which is something I spend a lot of time with, and I can see the same thing. It hurts. There's all these different coping mechanisms. It still hurts, and then we start to think about kind of the broader implications. So for most of us, at some point, we sort of reach this threshold where it's like the things that were working aren't working. So I don't know why I'm thinking this. So just sort of stream of consciousness. There's a 90s band called The Verve. They were a British pop band. And they wrote a song called "The Drugs Don't Work, They Just Make It Worse, and I Know I'll See Your Face Again." So this is kind of these threshold moments that we have. Like the things that I'm doing aren't helping. Sometimes as I sort of really start to engage in this process, it feels a little bit, it can be even a little bit more stressful. And I know that I'm going to keep bumping up against it. So from here, really what we start to work with around is this sort of regaining equilibrium. And this is really this component where we just sort of back away from the conflict, and we have to work with people around this sort of physical, cognitive, and emotional stability. This is this sort of retrain the brain phase around a specific problem. Not just to do it, not just as a practice, but you're a problem that I now need to solve. And now I have this opportunity to sort of do these things for myself in terms of I've got to get my thinking together. I've got to get my whatever you do is what you're going to do. I've accepted that. I didn't want to accept it, but I accepted it. And now I'm doing this sort of functional stuff for myself. So once we see sort of people engendering some of these qualities in terms of mindfulness again, sometimes they go back over here with a different perspective and work through it again. But to be quite honest, sometimes the work that they do is independent of that person for a while or that situation for a while. So what we're finding in terms of this work is we used to do a lot of stuff with conflict styles and, well, they're a blah, 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 and I'm a blah, blah, blah. And if they can just see my blah, 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 then we'll blah, blah, blah. But a lot of the time that really just feeds into this rational cycling. And then when this person just goes, nope, we're not doing that. We get back on the wheel. We're back on Google going, okay, well, maybe blah, 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 blah. Whereas if we can kind of move through this with the client, or move through this with our team and get to here, it's a very different place to be. So this place where, hey man, I'm gathering my attention, I'm recalling my intention, I'm attuning to my environment, I'm considering my actions, I'm enacting a plan here. And where you operate in space and time, like our boundaries are going to hit, but those are the things that need to happen no matter what. And when we do engage in conversation, and I know you're a hot button person for me, I'm going to listen without digging too deep into that because I know that it gets me to here. I'm going to loop back whatever I think can get us on the same side of the page. Like we do a lot of this. And so I'm just going to do this as much as you'll allow it, or as much as our system will allow it. And then when I sort of integrate this experience, I'm not going to integrate it the way that I have in terms of this rational cycling. I'm on to the next thing. So this all sounds well and good. And the reality is this. These are sort of tools that we help people to sort of develop over time. So today is just sort of here's an intro. Here's a couple of exercises. So now let's work with the team to sort of start to develop this in a more habitual way. So we're going to have some conversation. And we're going to have some situations where we're like, well, what about this or what about that? And those are really important in terms of now that we've got some tools, how do we start to solve some problems? So one of the things that we work with, and this you shared it very, very well, is everybody, no matter how good or bad they are at it, is trying to make meaning in some way. So even the people that we have the most conflict with, in their head, somehow it makes sense. And it's not up to us to figure why. It's just a basic idea that this is making sense to you. I don't know why. I don't have the mental bandwidth or the capacity, but this is somehow making sense to this individual. So once we sort of come with this notion of, I understand, as part of a team, we can go, I can kind of empathize with this. Again, the classic example, yeah, it's a business. I get it. I understand you have a bottom line that you don't feel applies to me in the role that I'm at, but I get it, right? I don't know where I fit within that, but I get it. And then this next component is, so what are we going to do together? And maybe that's the conversation that we have in that moment. Maybe that's the conversation that happens over a period of 3 to 6 months. And the reality is most of us are going to be some of us move around jobs to jobs a lot, but when I look around, a lot of us have probably been working in the same place for a while. Is that familiar? I see a lot of nodding heads. We've had time to kind of get into the muck. It's going to take some time to get out. So we just sort of start to work with these tools in that sense. Okay. The other piece, and I think I'll kind of end here, is just it's really important when we're working with teams and with clients is what's the influence that you already have? So within situations that are challenging, they're challenging. But outside of those situations, where are the areas where we already have some influence? Where are the areas where we already sort of make an impact? And sometimes it's sort of rededicating ourselves around those areas in terms of instilling some confidence. Again, we don't necessarily need to agree with what other people are saying, but what are the things that we can do to help the team be successful? And what are the things in terms of coming back to sort of patient-valued care, patient-centered care, where we can serve the greater good, independent of the many challenges that we face? Okay. So we did some hard stuff today. We had some interesting conversations, so I want to kind of end on a high point. Some of the research that we're doing now in the area of this whole notion of mindfulness leads us to 3 that are fairly novel conclusions. For things that were pleasant, as we sort of develop this attentional training and this new sort of quality of attention in the work that we do, the good thing is that pleasant things become more pleasant. You know, the sun shines a little brighter, the tree looks a little greener, the soup is a little soupier. Neutral things become more pleasant because there's a quality of attention there that there hasn't necessarily been before. And it's amazing what you can kind of notice when you can sort of start to work with this skill set a little bit in terms of things that you might not have seen before. The next component, though, and this is, again, back to our comment, this is reality. Things that are unpleasant, and I think this goes to your point too, things that are unpleasant don't magically become like roses and flowers. And I skip, but these are new shoes and I don't want to hurt myself. But I'm skipping. This is me skipping. That's pretty good. All right. So these unpleasant things don't miraculously become pleasant. But what we see now is we have a greater distress tolerance, which a lot of these skills train. And we see them for what they are in terms of them being not necessarily being permanent, that there's this sort of wave and fly, this ebb and flow kind of thing. So we take sort of 3 simple practices from what we've done today, this grace technique, this mindful communication, I should say 4, this sort of path diagram of how conflict kind of arises and passes away, and then just a little bit of for lack of a better term, faith in this evidence. 4 slides, honestly, we can just send everybody the 4, stick them on your fridge or wherever. And those are just simple tools that we can kind of start to work with. And really what I've found over, 2 decades of work now, like an undergraduate degree in health communication, believe it or not, a master's degree in counseling psychology, and a PhD in health psychology with a focus on performance, is that for whether you're somebody that's chronically ill or somebody that's sort of an elite performer, the more sort of simple tools that we can give people that they can embed into their daily life, those are the people that sort of see higher increases in performance over time, versus trying to give some big unwieldy package and 32 steps to whatever. So if it seemed a little simple today, it's just kind of a start, but I think these are some of the practices that pay sort of larger dividends. Okay. So one of the things that we really sort of have focused on today is developing this observational skill set around our own patterns of behavior, this sort of decision matrix around sort of what are the things that we want to cultivate or minimize, and then this sort of ability to sort of make more definitive decisions. So if we can sort of start to work with some of these practices experientially, not just on paper, it tends to lead to us doing engaging in these behaviors in a different way. Okay. So thank you very much for your time. And I just want to take a minute to chat about anything sort of other impressions or anything sort of situational that you wanted to talk about. And quite honestly, any of the yeah, but stuff, because I think that that's really, really valuable. I can honestly say when I was first kind of exposed to this stuff, I had a lot of yeah, but questions, and still do some days. And those are really, really valuable for us to kind of unpack as a team. So we'll share this moment of silence. Thank you very much for your time. I think, yeah.
So thanks again, Mike, that was fantastic. I think what we're going to do now is just take a few moments to stretch our legs, maybe get some coffee, quick snack, and then come back and we'll finish up with empathy and then some final questions and kind of a conclusion. Okay, so take a few minutes and then we'll come right back, 5-10 minutes. Okay, great.